Thank you. And thank you, Minister, for coming to the House for this motion. And thank you to my colleagues in Fine Gael, and in particular Senator Burke and Senator Keane, who brought forward this motion. Because, to be honest, before we came here to debate the motion today, I wasn't at all informed on the issue. I wasn't fully aware. I had a vague understanding that maybe people had rare diseases, but I'm not claiming to be an expert on it. But I do really welcome the fact that I've had to immerse and learn more. Because while we can be mindful that that these diseases are rare, suffering from a rare disease is not. In EU-wide, it's astounded me that EU-wide the number of rare disease patients is equivalent to the populations of the Netherlands, Belgium and Luxemburg combined. So, I think that for me really hit home of why we need to do more. I think I would have liked to see if this motion could have recognises that illnesses affect children far more than any other group. 75% of rare diseases affect children. In the United States, for example, 50% of recognised patients are children. And tragically, 30% of all patients die before they reach the age of 5 years of age. And faced with figures such as these, it's clear that making access to a proper diagnosis and appropriate treatment is a clear public health priority. And given the numbers of children who die before the age of 5, it also shows the importance of a timeliness of ensuring diagnosis. 41% of respondents to a Genetic and Rare Disorders Organisation patient experience survey do not feel that they have access to the best medical care for their condition. Furthermore, without a diagnostic system in place, the state leaves rare disease sufferers facing long delays in diagnosis and even a misdiagnosis before their actual condition can be addressed. And the consequences of delays in diagnosis are actually quite dramatic, ranging from obviously loss of confidence in the healthcare system, but also having other children within families born with the same disease, a decline in the physical, mental and emotional well-being of sufferers, and even leading to the premature death of patients. And I was stunned to find that a survey by Eurodice on diagnostic delays revealed that 1 out of 6 sufferers in Europe underwent surgical treatment based on a false diagnosis. So that's 1 in 6 who undergo surgical treatment due to a false diagnosis. Many rare disease patients suffer profound and multiple disabilities, and while this issue does not address the wider issues faced by such patients with regard to basic facilities such as carers, respite services, the geographical differences in the standard of care that patients can expect, nevertheless, I give the motion my full support. I think it's a step in the right direction. I very much welcome its introduction into this House. Now that I am more knowledgeable about the issue, it is something that I will endeavour to follow more closely. So I thank my colleagues and I give it my full support.
Tara?